Yet another new session of SS Edu Talks. So nowadays we are all hearing about convalescent plasma therapy, which have the probability to treat against COVID-19, isn't it? So let's talk about convalescent plasma therapy and what are all the matters that comes under it. Before that, we have to know about what is convalescent. Convalescent is a state in which a person has recovered from a disease or an infection. Yeah, and plasma is a major constituent of the blood, which constitute about 55 percentage. Okay, so in convalescent plasma therapy, the plasma from a person who has already recovered from the disease is taken and it is administered to a deceased person. Okay, so whenever a person, an otherwise healthy person, get an infection, the person's body will try to make so many antibodies to fight against the infection and it tries to kill that. Okay, so it helps to make the individual clear out of the infection or cure the disease. So after recovering from the disease condition also, the patient's plasma contains antibodies. So this plasma which contain the antibody is used to treat the disease. Yeah, and this plasma is used in the convalescent plasma therapy. So first of all, what we are doing is that the whole blood from a person is taken out and the plasma is separated through a technique called apheresis, and the remaining content will be transfused or administered back into the donor itself. Okay, so from a person, if a plasma is taken, we can treat 3 or 4 deceased persons. So about 200 ml of plasma is needed for one person. Okay, so about 200 ml of plasma which contain the antibody is administered to a person which have the disease, and the antibody in that plasma will try to fight against the infection and will clear out of the infection. Okay, so it helps the person to recover from the disease. So it is not, and this concept this one like convalescent plasma therapy is not a new concept. It has been used for years and years. It has been used in Spanish flu pandemic in 1980s, and it has also been tested in in some outbreaks like H1N1, MERS, Middle East respiratory syndrome, and SARS as well. And it has also been tested and it is found somewhat effective in some studies from the China during the corona outbreak. Okay, so what about in India? Convalescent plasma therapy in India, it's like when any new treatment intervention has to be implemented in India, we have to get a permission from the government body called ICMR, that is Indian Council of Medical Research. And in this condition, some states have already got permission from the ICMR to test the convalescent plasma therapy, but the ICMR has strictly insisted that the CPT, that is this plasma therapy, has to be tested on an experimental basis only and not in a treatment basis. Okay, so what are all the conditions which have to be fulfilled during an experimental purpose? That conditions should be strictly followed while testing this CPT. Okay, so what are the conditions according to the ICMR which have to be fulfilled for a donor who donates a plasma? Okay, so the first condition is that the person must be recovered from the disease and the antibodies in that person should cross or should have a limit which have the amount which is higher to that specified in the ICMR, and the age should be above 18 years, and there should be no symptoms for 14 to 28 days, and the PCR test should be negative for 2 times consecutively. So these are the criteria. So after all these hurdles only, we can implement these convalescent plasma therapy for treating the COVID-19 infection. So we can hope that we can clear out all these hurdles and we can wipe out this deadly coronavirus from the globe. So hope you all like this video, and if you like, please do subscribe and like and share. So thank you so much.